everybody, and happy Heart Month. I'm Kayla Thomas with Nebraska Medicine, and today we are teaming up with the American Heart Association to talk about heart disease awareness and prevention. We have two special guests with us today, Dr. John Higgins, who's a cardiologist here at Nebraska Medicine. Thank you for being here.
Thank you for having me.
Absolutely. And Jennifer Redmond is with us today. She is the Executive Director of the Nebraska Chapter of the American Heart Association. Thank you for being here.
Yes, excited to be here.
Absolutely. So let's start just kind of talking about the scope. How prevalent is heart disease?
Oh, geez. Heart disease is the number one killer of all Americans, and many people don't realize that. The thing is that it's also 80% preventable. And, it's important to talk to your healthcare provider, talk to your doctor, know your warning signs, eat healthy, exercise, all of that, because it can have a tremendous impact on your overall health.
And I love Heart Month and kind of bringing that awareness, wearing red, just thinking about our hearts more. I think a lot of people are used to hearing that heart attack symptoms are different in men and women. So Dr. Higgins, can you tell us what those symptoms are?
Yeah, so one key thing to keep in mind is that still the old-fashioned chest pain is the most common symptom in both men and women, but women can have varying presentations beyond what the traditional scope of symptoms are. My job would be a lot easier if everyone showing up to the emergency room just told me they had an elephant laying on their chest and they couldn't breathe,
Right.
But that's not the case for everyone. So obviously the key symptoms to look out for, regardless of gender or sex, is chest pressure, tightness, squeezing sensation in the chest, particularly getting worse with activity or emotional stress, problems breathing, sweating, and that pain can radiate into the jaw, down the arm, numbness. But it can be a whole lot of varying symptoms, and it just depends on the person. So we know that women are less likely to present with classical chest pain symptoms. And even though chest pain still is the most common symptom, as opposed to up to 40% of women when they present for the heart attack don't have typical chest pain type symptoms. So one thing that we're trying to be more aware of is trying to figure out what those equivalent symptoms are, and particularly with shortness of breath and any of these symptoms being brought on not just by walking upstairs or shoveling heavy snow like we associate, but also with emotional stress and other type things that may be thought of as more atypical, but just keeping the whole patient scope in mind and knowing your symptoms as well too, and just knowing that it's tough to know exactly what someone's warning signs are.
And it's such a big deal, so important to get to the hospital fast if this is happening, or if you're in the area and you recognize someone might be having these symptoms. I've talked to some of our patients here who've said, oh, it's nothing, but then when they have gone and they've realized it really saved their life to get here quickly. How and why is it so important?
Oh, well, I mean, there's a saying in cardiology that time is myocardium. Myocardium is just the medical term for heart muscle, but it's really true. If you're having a major heart attack, the timer starts right then. So when we have someone come to the emergency department and we have evidence on an EKG that it is one of these major heart attacks, we try to get them into the cath lab and try to restore blood flow to the heart muscle within 90 minutes. So we know that the longer that you wait, the more likely it is that the heart muscle is just going to become scar, and problems are going to persist forever for a patient down the road, which is why it's so important, even if you're not sure, to come in, get an EKG, get some initial blood work, talk to a medical provider, and that way things can be stratified from there. And but certainly I've seen terrible things happen when people wait for days and then they come with some terrible complication of having a heart attack, something that could have been treatable if they would have known what their symptoms were and come in sooner to get checked out.
And I think since we're talking about awareness this Heart Month, it's a good time to think about things like CPR training, AED training. How easy is it for someone to learn how to use CPR or how to be prepared? AEDs are everywhere now.
Right. You know what? It's super easy. So there's no excuse. I will say it over and over again, and I know that you'll agree with me, is that CPR saves lives. And I'll say it again, it saves lives. We have on the American Heart Association website, heart.org, a list of training centers that are across the state. And so super easy to get on there and check out, local American Heart Association training centers. And then we also have a hands-only CPR kiosk located at Westroads Mall that was given to us by a very tremendous donor. And this machine, it has a mannequin, and you can perform hands-only CPR. You can learn CPR in a minute. And so, like I said, there's no excuse. And the thing about this machine, it's wonderful. You got to check it out. It's going to tell you, are you pushing hard enough? Are you pushing fast enough? And it's scoring you. And so if you're not getting that perfect 10, you do it again until you get that perfect 10. The truth is that by learning CPR, once again, like I said, it's saving lives, but it's also empowering people to take action in the case that they need it. And unfortunately, hopefully they don't have to, but a lot of times it's a family member, it's someone that you know, it's someone that you love, and so highly, highly important.
Dr. Higgins, how often do you see that? So where someone basically just saves someone's life?
Oh, there's not a doubt, and it's not just saving someone's life, but also providing quality to that person, so they can leave the hospital and walk out and live their normal life. So instead of waiting, if someone doesn't have a pulse or is passed out, and I've had had this happen to a family member, it's just so important to provide that flow to the brain and everything like that, and just give someone the best shot that they have, because obviously that's a big deal when the heart stops and the pulse is not going. But CPR training and AED training too, and these things, some people get intimidated that how hard it is and how difficult, but you don't have to know every step down pat. It's just providing those chest compressions, hooking up the AED and listening to those instructions that can really save lives and really impact someone's life and the whole families. There's so many downstream effects that we see from it.
Yeah, they say, by performing CPR, it can double or triple a person's chance of survival. So those are pretty alarming statistics.
I think it's important today to think about your own health, your own symptoms, but also to think about, hey, it's February, what can I do this month to really further cause? And CPR and AED use is hugely important. Yeah. Prevention is key too. You mentioned 80% preventable earlier. That's 80%. So what do people need to do to keep their heart in as good of possible health as possible?
They need to, exercise. We talk a lot about exercise. We talk a lot about, eating healthy, knowing your numbers, which I'm sure you can, can speak to knowing your numbers, meeting with your doctor. Just being an overall advocate of your health is so extremely important. And that's, mental health too. It's all around. It's, the more you take care of yourself, the chances of, having a longer, stronger, healthier life are just going to increase.
And this is where I piggyback one tool that I use for patients is the AHA's Life Simple 7, which is a really great tool, and it just shows how much of a collaborative effort it is between myself as a healthcare provider and as well as my patient. So there are 7 steps. And granted, everything's a spectrum, but any little bit that you can do is going to help you, not just help your heart health, but just help you feel better in general. So those steps include eating a healthy diet, trying to avoid really bad food, foods that are processed foods that are high in sodium, high in saturated fat, high in sugar, processed grains. Now, granted, it would be great if everyone could eat salmon and boneless, skinless chicken breasts and become a vegan. Right. But there's a
moderation. We can have a cheeseburger, just not every day.
Because people get discouraged, and it's like I can't eat like this for the rest of my life. But just knowing and making eating good, cooking your own food, just eating whole foods, that's one key. Getting up, moving around, and exercise. 75 minutes a week of vigorous activity or 150 minutes a week of moderate activity. And you can add those up in steps. So it's not, you don't have to dedicate yourself to going to the gym if that's not something that's going to work, because we all have busy lives. My kids keep me busy, my job keeps me busy. But doing anything I can to keep my heart moving and keep going and trying to allow my heart to keep pumping blood for as long as it can. Keeping a check on your weight. Don't smoking. Obviously, that's. And that that includes obviously not just combustible traditional cigarettes, but also e-cigarettes too. And we just don't know what the effects of are now, but they're not good for you. It's not that hard. Right. It's not good. And then the other kind of factors. So other than diet, activity, not smoking, healthy weight, is some things that your healthcare provider can help out with you. If you have diabetes, keeping your blood sugar under good control. If you have high blood pressure, keeping your blood pressure good control, and keeping your cholesterol in good control. If you have any sort of abnormality with your blood cholesterol, and sometimes the lifestyle modifications we talked about can just take care of all that by itself. But if not, having some extra help from your healthcare provider is the best thing. And we know that it's a shockingly low percentage of people are able to hit all 7 of these things, but they're kind of basic healthy lifestyle goals that we should all try to emulate.
And knowing your family history, that's important as well.
Yeah, that's absolutely. So we know that, beyond, your traditional risk factors like, obviously people like we said, people that smoke, people that have diabetes, people that have unhealthy cholesterol or blood pressure at higher risk, but certainly having a family history, and particularly a family member that had heart problems at a young age, so younger than in the 40s or 50s, if you had a parent or a brother or sister having problems at those ages, we know that your risk is higher. Whatever genes you have are going to increase your risk. So that's another reason to get checked out and maybe be more aggressive with your medical therapy to try to prevent something happening, because it's so much easier to live with maybe a couple of extra medications than to deal with the consequences like we were talking about earlier with a major heart attack.
Absolutely. You both look fabulous in your red pins. Go Red Day is Friday.
Yeah.
So what do you want people to do on that day?
You know what? Wear red. It's a day to raise awareness. It's a day to recognize actually women in heart disease. Many people don't realize that 1 in 3 women will die of heart disease. And so it's looking at that. It's often thought of as a man's disease and maybe an older man's disease, and that's simply not the case. And so, wear red, show your support. If you work at a company, have your buildings go red. I know even right here, the Cancer Buffett Center is going red in support of Wear Red Day. But it's also the kickoff to American Heart Month. And so we're going to be seeing activities all throughout the month, which is super exciting. When we look at women in heart disease, when you say 1 in 3, about every minute a woman will die of heart disease. And so, we're sitting here and, say 30 minutes, chatting, 30 women will have lost their lives. But we also encourage you to post on social media and share your stories, share, why you're involved, why you're wearing red. And we've got, it's hashtag #GoRedNE for Nebraska. And so feel free to post that.
All right. Any closing thoughts, Dr. Higgins?
So, my main thing is just, obviously February is a great month for everyone to, to kind of take stock and think about their heart health, but overall just, general health. We're getting out of winter. It's a great time of the year to try to make some steps, get outside, be more active, take care of your bodies, take care of your health, so to prevent heart disease down the road. And that's just what I want to see into the message that not only I'm trying to live, but trying to give to my patients as well.
Thank you very much, Dr. Higgins. Jennifer, thank you for joining us. It was
thank you.
fun to team up today. And here's to all of our hearts. If you want more resources, the American Heart Association website is heart.org. You can find more information on these services we offer here at Nebraska Medicine at nebraskamed.com/heart. Thanks for watching, everybody.